Hello, this is Paramjeet Singh. Thank you very much for stopping by once again. Since the start of COVID, anxiety have been ramping up for everyone. But today we are going to talk about a special subset of the population for whom anxiety may be going up for an entirely different reason. And that different reason is surgery. If someone has to have a surgery, whether it's elective or urgent, it tends to be attended by a heightened state of anxiety. Research indicates that unaddressed preoperative anxiety and depression tends to have a considerable consequences in the post-operative times. So for example, pre-operative anxiety and depression are related to the pain at the post-operative level, agitation, nausea, the length of intubation, as well as the healing process. Usually within the hospital setting, hospitals often have in-house counseling process for individuals who are going through anxiety process before going under the knife. But it has been found that since most of the individuals experience peak anxiety before admission to the hospital, sometime, and in spite of the skill level of the clinician, the in-house counseling may be not that effective in reducing the anxiety. And in other ways, hospitals also use anxiolytics, which are anxiety reducing agents, which have a significant positive impact on the recovery process in the post-operative times. In that context, there's another thing that is mentioned in a paper published in the British Journal of Anesthesia a couple of months back, and they suggested that since anxiety and depression have considerable impact on the outcome in the post-operative times, could mindfulness be useful? And they suggested that it is possible that mindfulness is one of the underrated, underutilized intervention in the context of the surgery. And we know from research that mindfulness has a robust evidence to impact positively anxiety and depression, but it also has a positive impact on chronic and somatic conditions such as chronic fatigue syndrome, irritable bowel syndrome, cancer, cardiovascular problems, chronic pain, in addition to others. So it is naturally becomes a viable direction to explore if mindfulness can be used in the context of the surgery. And having people run through the mindfulness exercises in the before the preoperative times, before individuals are admitted into the surgery, whether that surgery is elective or urgent, can be helpful in mitigating the anxiety of the individuals, thus having a positive impact in the post-operative times, which will help in the chronic brain scores and also as well as in the healing recovery mechanism, nausea, agitation, and general healing from the surgery itself and back to the normal which somebody inspired after the surgery. So one of the reasons why I wanted to share with you today this is that if you have someone in the family who is waiting to go under surgery, whether that surgery is elective or urgent, maybe teaching them few mindfulness skills could be a useful way to work with whatever comes in the times of surgery and what comes after the surgery. And if you are interested in learning mindfulness skills, you can check out my previous videos in this series. And if we can be helpful, kindly reach out and we will be happy to give you some starter kit on being mindful. Anyhow, that's it for now. This is one thing I wanted to share with you. And until next time, thank you and stay safe. Bye-bye for now.
Please subscribe to the channel, like and share. Thank you.